Welcome back to Nursing Notes and Knowledge, and if you're new to the channel, I'm glad you stopped in. Did you know that too much serum sodium can be life-threatening? What happens when the sodium levels become elevated in the body? Hypernatremia just isn't a lab value, it's a life-threatening emergency. Think to yourself, brain, swelling, confusion, seizures, and even coma. As future nurses, recognizing the signs of hypernatremia early can save a patient's life. In this video, we dive into everything you need to know about hypernatremia, an important electrolyte imbalance you'll definitely encounter while in nursing school, at your clinical rotations, and for your NCLEX examination. Hypernatremia is a condition where the sodium level in the blood is too high. Typically, a serum sodium level greater than 145 milliequivalents per liter. This can lead to neurological symptoms, fluid balance issues, and serious complications if not treated quickly. Now you've gotten a glimpse of how dangerous high sodium levels can be, especially when the brain function deteriorates. In this next part of the video, we'll walk through a clear and concise presentation that covers everything you need to know about hypernatremia. This presentation serves as an essential guide for your daily nursing practice, providing you with key nursing knowledge for effectively managing sodium imbalance. All right, for our agenda today, we will cover several aspects of hypernatremia. Topics include fundamentals of fluid and electrolyte balance, explore the pathophysiology of hypernatremia, review clinical manifestations and patient assessment techniques, and finally discuss nursing treatment management along with priority patient care actions, strategies, monitoring, and patient safety. Understanding the body's fluid compartments and sodium's essential role is crucial for grasping how electrolyte imbalances like hypernatremia develop and affect the overall care and management patients receive. Next, I'd like to briefly go over a quick overview of body fluid compartments. The human body contains intracellular and extracellular fluid compartments, with sodium predominantly found in the extracellular space. Sodium helps with maintaining fluid balance along with osmotic pressure. The role of sodium includes helping to maintain this osmotic pressure and fluid distribution throughout the body. The intracellular fluid compartment consists of fluid that is within the cells. This constitutes most of the total body water found in our bodies. And then extracellular fluid compartment, this is fluid that surrounds the cells and contains high concentrations of sodium for fluid balance. I added this information previously in my hyponatremia video if you'd like to check that out. I decided to include it again due to the importance of understanding this topic of different body fluid compartments and how patient treatment is managed as far as where the fluid excess or fluid deficit is. Role of sodium within the body. Sodium is vital for nerve function, muscle contraction, and maintaining blood pressure through regulation of water balance between compartments. With nerve function, sodium ions are essential for transmitting nerve impulses throughout the body to enable communication between the cells. Muscle contraction, sodium plays a critical role in muscle contraction by triggering electrical signals that stimulate muscle fibers. Blood pressure regulation, sodium helps maintain blood pressure by regulating water balance between body compartments and controlling fluid volume. How does the body achieve and maintain a state of homeostasis? Homeostasis involves kidneys, hormones like aldosterone and antidiuretic hormone, which regulate sodium and water absorption with excretion to maintain stable plasma sodium levels. The three main mechanisms include kidney function, the role of aldosterone, and the function of antidiuretic hormone. Kidneys filter blood and adjust sodium excretion to maintain the stable plasma sodium concentration. Aldosterone is a hormone which increases sodium absorption in the kidneys to help balance sodium levels and blood pressure. And lastly, the function of antidiuretic hormone. Antidiuretic hormone regulates water reabsorption, indirectly affecting sodium concentration in the plasma. Pathophysiology. Hypernatremia is the result from a disruption in either sodium or water balance. As the bedside nurse with a patient presenting with elevated sodium, it requires understanding of what is the causative factor or factors that cause the hypernatremic state, as well as identifying if your patient is an at-risk or vulnerable patient to electrolyte imbalances. Definition and diagnostic criteria of hypernatremia. Hypernatremia occurs when serum sodium levels exceed 145 milliequivalents per liter, indicating elevated sodium concentration in the blood. As far as diagnostic threshold, a sodium level above 145 is the clinical cutoff for diagnosing hypernatremia in patients. Diagnosis requires laboratory evaluation combined with consideration of the patient's clinical presentation. There are typically two mechanisms causing hypernatremia, either water loss or sodium gain. With excess water loss, loss of water through dehydration, diuretics, or diabetes insipidus can increase sodium concentration in the blood. With increased sodium intake, excessive ingestion of salt leads to elevated sodium levels, contributing to the hypernatremic state. Hypernatremia typically results from water loss. It means there's not enough water in the body to balance sodium levels, causing cells, especially brain cells, to shrink. Risk factors and patient populations at risk. Elderly, infants, and patients with impaired thirst or limited access to water are especially vulnerable to hypernatremia. The elderly population is at an increased risk due to impaired fluid regulation, chronic conditions like kidney disease, and decreased thirst response. Infants face an increased risk for hypernatremia due to immature kidney function and limited fluid intake. And patients with impaired thirst sensation or limited access to water have increased risk for developing hypernatremia as well. Clinical manifestations, signs and symptoms, and patient assessment. Recognizing hypernatremia's signs and symptoms and performing a thorough assessment are essential for timely diagnosis and patient treatment. Signs and symptoms of hypernatremia. Thirst, dry mucous membranes, neurological symptoms, and severe symptoms. Thirst and dry mucous membranes are early signs of hypernatremia indicating dehydration. Neurological symptoms, which include confusion, muscle twitching, and seizures, reflect the neurological impact from cellular dehydration in a hypernatremic state. And with severe symptoms, hypernatremia can lead to coma. This underscores the critical nature of this electrolyte imbalance. Physical and neurological assessments. Patient assessment focuses on hydration status, neurological function, vital signs, and identifying complications to guide intervention. With hydration status, assess patient hydration to prevent complications and ensure treatment is effective. In terms of neurological function, evaluate function to detect abnormalities and guide intervention decisions. Assess patient's mental status for attention span and cognitive function. Hypernatremia with normal or decreased fluid volume, the patient may present with a short attention span and be agitated or confused. When hypernatremia occurs with a fluid overload, the patient may be lethargic, drowsy, stuporous, and even comatose. Monitor vital signs. Check vital signs hourly, identify trends and any changes in patient's presentation. Skeletal muscle changes may vary. Mildly elevated sodium can cause twitching and irregular muscle contractions. As hypernatremia worsens, the muscles and the nerves are less able to respond to stimulus and muscles become weaker. Late signs are deep tendon reflexes becoming reduced or absent. Identify other complications, measuring blood pressure and heart rate, and quality of apical and peripheral pulses. Heart rate may be increased. Laboratory and diagnostic evaluation. Serum sodium measurement is essential for diagnosing hypernatremia and monitoring electrolyte balance. Osmolality tests assess concentration of solutes in blood and urine to evaluate hydration status, and urine studies help identify renal causes of hypernatremia and assess kidney function. Nursing management and interventions. Effective nursing care involves prompt intervention, careful monitoring, and patient education to prevent further complications and recurrence of hypernatremia. Immediate and ongoing interventions. These include fluid replacement, monitor neurostatus, prevent rapid sodium correction, and treat underlying causes. Fluid replacement. Administer fluids to restore and maintain patient hydration levels promptly and effectively. Neurological monitoring. Assess neurostatus to detect any changes or deterioration in patient condition. Sodium correction risks. Avoid rapid sodium correction to prevent complications in patient care. Treat underlying causes. Identify and address the root cause of patient's condition to support recovery. Sodium correction must be gradual to avoid cerebral edema. Regularly lab monitoring, adjusting treatment plans are critical nurse responsibilities. Nurses play a vital role in monitoring patients and making adjustments to their treatment plan. Treatment and additional nursing interventions. As the bedside nurse, your goal is to gradually lower sodium levels and restore fluid balance. With IV fluids, you want to start hypotonic solutions like half normal saline, 0.45% or D5W as ordered to dilute sodium. Monitor your patient for cerebral edema if sodium drops too fast. Monitor closely patient daily weights, strict I's and O's, monitor vital signs and neurostatus regularly. Lab values, check your sodium and osmolality levels. As far as patient safety, you should implement seizure precautions, reorient confused patients, and encourage fluids if appropriate. Now, key point to remember, sodium correction should be slow and controlled to avoid complications like cerebral edema. Also, a real-life clinical tip, watch for hypernatremia in elderly or immobile patients who can't access water independently or patients receiving tube feedings without additional free water. Here I have a table with a side-by-side comparison for both hypo and hypernatremia. This lists common causes, signs and symptoms, and treatment modalities for each disorder. Patient education and prevention strategies. Educating your patients on proper hydration supports overall health and aids in disease prevention. Encouraging consistent medication use improves treatment effectiveness and reduces patient complications. And teaching patients to recognize symptoms early enables timely medical intervention and better outcomes for your patient. Enhancing nursing practice with hypernatremia care. Recognizing clinical signs. Early identification of hypernatremia symptoms enables timely nursing interventions to prevent patient complications. As far as nursing interventions, applying appropriate strategies improves overall patient safety and treatment outcomes. Hypernatremia may not always be obvious, but the consequences can be severe. Stay alert for early neuro changes and always think, is the patient dry? If this video helped you feel more confident about hypernatremia, give it a thumbs up and subscribe for more clinical nursing content, as this helps my channel grow to reach a larger audience. We'll see you on the next one.